I'm hoping that other providers in Minnesota will understand more about CFS, Christian Family Solutions, day treatment program based on our conversation today. Who are the clients who are best served by us?
Right. Yeah. So most of our teens who present have symptoms of depression and anxiety, or a trauma history that's resulting in some more depressive or anxiety presentations. We also have several teens who struggle with defiant behaviors, either at home or at school or in the community setting. And so that could be an option as well for just the teens who are struggling to benefit from that once weekly counseling session. Or maybe the teens who you're thinking about a little bit more between sessions and you're concerned about their safety in the community or how they're functioning. That could be a sign that they might benefit from a little extra dosage of care, such as in a day treatment setting.
I know that we also work with clients who come out of inpatient settings. Yeah. How easy or seamless is that, I should say?
Yeah. So if a teen is accessing a higher level of care, whether that be an inpatient placement like a hospitalization, residential treatment, or even a partial hospitalization program, the day treatment setting has been a nice step down to kind of bridge them back into the community. So we're still targeting significant mental health concerns, but that teen is able to remain in the community setting and also engage in school for a part of the day. Within our day treatment program, they're here for 3 hours per day, but then they're going back into the school setting either before or after groups, depending on what group they're in. And so it really allows us to stay like in touch with community supports while also receiving those intensive mental health supports as well.
What is a typical treatment day like at CFS? And I know it's around 3 to 5 months of a length of a program.
Sure. Yes. Yeah. So each day when our clients arrive, we have kind of a morning track and then an afternoon track. And our groups are split up by gender, but also developmental functioning. And it tends to be more of like a middle school age range group and then a high school aged ranged group. But again, based on developmental functioning. And so when our teens arrive on site each day, we're going to start with an emotional coping skills group. So our teens kind of do a check-in. How have things been since we saw you 21 hours ago? Any like crazies that we should be aware of or significant conflicts? And just in general, like, how are you doing today? And then we teach them an emotional coping skill so that they can just kind of have a skill in their back pocket for the rest of the group, for the rest of the day, and then hopefully beyond today as well, something that they can carry into the future. For our second hour each day, we do a therapy group. Our therapy is primarily cognitive behavioral therapy. We also are DBT informed, trauma focused. Most of our providers here have been trained in trauma focused cognitive behavioral therapy. So being able to integrate psychoeducation, but also understanding how our thoughts and our feelings in the present moment are impacting us and how those might be related to past experiences or future anxieties. Those are things that we're going to talk about in that therapy group. And we also give teens an opportunity to process with one another kind of conflicts or concerns that they might be having in their own life. We know that teens are often really drawn to receiving peer support, which is developmentally appropriate, but being able to be in a process group setting allows for a therapist to be present and navigate some of those conversations as well. I know for myself as a therapist, the teens are always like, come on, Caitlin, but I add in, like, okay, so this is the pattern that I'm seeing play out right now. And this sounds a lot like what you went through last week. Let's talk about how we can cope with this better. So just being able to insert psychoeducation in maybe a way that's a little bit more friendly to teens is something that we really strive to do here as well. And then our last group of the day is going to be a social skills group. And so we know that anxiety, depression, trauma histories, they can definitely impact how we interact with others in the world. And so that last group, we always teach us a specific social skill and then give teens kind of more of a playful opportunity to practice that, whether that be in a role play or a game, or a conversation setting, some sort of activity, but an opportunity to practice those social skills that they learned that day. That's what groups looks like. We also have individual and family therapy that are integrated into treatment as well. So a teen is going to have at least one individual session each week, and then family therapy can occur inside or outside of day treatment hours. for some providers here, they might be saying like, I have a family that will not do family therapy. We're obviously going to recommend family therapy for most family systems. However, if a family chooses to not engage with that, we're going to do our best to offer them parent support. But that's not necessarily a rule out for treatment if the family system is not actively willing or engaged to participate within the family therapy.
Who maybe would not be a good fit for this program?
Yeah, so something that our team would want to look at is co-occurring diagnoses, whether that be a substance use disorder, an eating disorder, maybe a cognitive or developmental disability. Not necessarily like if they have that diagnosis that it's going to be a rule out, but just something that we might need to augment treatment plans and or consider a referral to a different program. So during the intake, our team is going to look comprehensively at, what are the presenting concerns? What can we target and really expect to see rehabilitative growth within? And where might we want to look towards an external referral, whether that be a licensed alcohol and drug counselor, an occupational therapist, maybe even an referral for inpatient CD treatment, depending on the severity of that situation. And I would just say too, if you're viewing this video and you're like, I don't know what that looks like for me, reach out. Our team is happy to consult too regarding, who could be a good fit. And so if there are presenting concerns that you think they could be a good fit for this program, but you're not quite sure, we'd really be happy to have a conversation with you so that you can make the best referrals possible for your team.
One of the highlights that I've heard from you and your team, Caitlin, is collaboration, how important that is with case managers and with providers. And I guess I could say that the effectiveness of long-term care is because of that collaboration. Would you agree?
Yes. It's really helpful to have a warm handoff from a therapist if that client was actively working with somebody, whether it's an individual therapist or a case manager, somebody who knows the family history, being able to relay that information to our team so we can understand histories. If they are actively engaging with other providers in the community too, we want to make sure that we are just being able to coordinate with them, whether that's medication management or other supports, school counselors, so our teams can be the most successful as possible in the community. And then when a client discharges from the program, we do want to make sure that they have adequate supports in the community too, so they can be as successful as possible. So we really do love to have a discharge meeting with multiple parties who are present, parents, case manager, counselor who they're discharging to if possible, and relay that information to just have the best continuity of care.
We are Christian Family Solutions, and faith is integrated upon request. How does that work for you and your groups?
If a client desires to have faith integration within treatment, all of our providers have been trained on how to provide evidence-based care that integrates faith and spirituality. A bulk of that faith integration does come in the individual setting, so we can really tailor it to clients as requested. And we really just ask that everyone be respectful and considerate of one another and where they're coming from. If a teen is not interested or the family system's like, we don't want to integrate faith and spirituality into treatment, but we do still need a day treatment, that is okay too. We have many clients who come from Christian backgrounds. We have many clients who do not have a faith and spiritual background that's from a Christian basis, and that's okay too. We really just want to help as many people as we can and meet them where they're at and offer them evidence-based care.
Would you give an example of a teen who may have needed help, participate in the program, and now is thriving with long-lasting results?
One of the things that we're able to do in this day treatment setting is create a space that teens feel comfortable and where we really accommodate to allow them to open up and take the time that they need in order to feel safe and process in those settings. So I'm thinking of one client specifically who the first day they sat in their car outside for the first hour of treatment, and our team was out there like interacting with them and just trying to reduce anxiety, and made up a really solid plan for re-engagement for the rest of the week. And that by the end of the week, that team was engaging within groups, They were in a program for about 5 months. And upon completion, we're using those social skills that they got to practice in the group setting, had a reduction of anxiety, going to full school days, which for this teen was not happening prior to being in treatment, and engaging in family therapy too. And just being able to have a more open relationship with their parents. So here at Christian Family Solutions, our team really believes that it starts with the relationship. And so we really focus on cultivating those nurturing relationships with clients, so that they can know that they are valued and that they're worthy of care and support. And that really impacts how they view themselves and how they interact with the world around them.
This is great, Caitlin. Very informative, educational, and I know that together we can collaborate and serve more people. Thank you.
Thank you.